Welcome everyone to today's virtual showcase hosted by the USC Suzanne Dworak-Peck School of Social Work. My name is Jennifer Chung Van Zini, and I'm the Director of Advancement here at the School of Social Work, along with Kelsey Viano. She will be joining us later to moderate the Q&A. She's the Foundation and Corporate Grants Manager. We are so excited to have all of you join us today here in January of 2021. Happy New Year to all of you. And we would like to go ahead and start today's showcase highlighting our MVP military and veterans programs. Today's speakers are Dr. Carl Castro and Dr. Sara Kintzle. And just a couple of housekeeping, today's webinar is recorded and we do have it live on Facebook. Please use the chat box to share comments and to type in your questions. Again, we will have a moderated Q&A session towards the end of the presentation. So please feel free to use the Q&A box to enter your questions throughout the presentation. Without further ado, I'm going to go ahead and introduce first Dr. Carl Castro. He is a professor at the USC Suzanne Dworak-Peck School of Social Work and the director of the Military and Veterans Programs. Dr. Castro is widely recognized as a leading military health theorist and researcher. And he is also a retired colonel who has served 33 years in the U.S. Army and served in a variety of research and leadership positions. We are very honored to have him today, and he will go ahead and start us off. Dr. Carl Castro.
Thank you so much, Jennifer. It's a pleasure to be here today, and I hope everyone is off to a wonderful new year and they're in the throes of the new year. I am so proud to be able to introduce the great speaker today, Dr. Sara Kintzle. She is a world-renowned expert in military and veteran health and well-being. And today she's going to present, I think, some very, very exciting data looking at veteran health during this COVID pandemic. Sara is leading the U.S. effort as part of an international effort to understand how the COVID pandemic is impacting veterans around the world. So without further ado, I'm going to turn this over to Dr. Sara Kintzle, and you are all in for a real treat today. So thank you for joining us today as Dr. Kintzle presents for the first time some very exciting data.
All right, hello everyone. Thank you so much, Dr. Castro, for that welcome. Thank you all for being here, and thank you for your interest in how our veterans are doing during these very challenging times. I'm going to go ahead and jump right in. We have a lot to get through today. There's going to be a lot of information on the slides. We're going to be sure you have access to that. So, and of course, we'll have a Q&A at the end. But if I don't hit on something on the slides that you're interested in, be sure to put a question in the chat box, or if you'll feel free to follow up with me after the presentation. So thank you again, and we'll go ahead and get started. Before we do start, I want to take a quick moment and thank and recognize the Prudential Foundation. They are a really incredible supporter of the MVP, and it's that kind of support that's provided that allowed us to quickly respond to the events of the pandemic and rapidly respond to the challenges that have brought on for our veterans. So thank you so much to Prudential. As Dr. Castro mentioned, this is an international COVID-19 veteran impact study. It's led by the MVP by Dr. Castro, and it's a collaboration between the US, Canada, and the UK, examining the impact of COVID-19 on veterans. The study explores the transition to telehealth care, feelings and behaviors around the COVID-19 pandemic, and overall well-being, how our veterans are doing during these times. We collected 2 phases of data, and most of the data we'll look at today is from the first round of data that was collected this past summer from June to August 2020. We just finished a second round of data collection looking at changes over time, and that was collected in November and December. And we will share a little bit of that data today as well. Real quickly, looking at who participated in this study, looking at the demographics, we had a little over 400 veterans participate in the study. The sample is representative demographically as far as race and ethnicity and gender. We have almost 30% of the sample is women. The age ranged from 25 to 94. Time since leaving the military ranged from 1 to 42 years. And about half the sample served prior to 9/11 and half served post 9/11. So a pretty representative sample was participated in this study. One of the first things we looked at was the shift in the use of telehealth care. And you can see here, 62% of veterans in the sample reported using telehealth care for some type of care during COVID-19 since it had started. And this pie chart here shows about 31% of that telehealth care was for mental health services, 29% was for physical health care, and 40% used it for both physical and mental health care. And prior to COVID-19, 71% had never used telehealth to access physical health care, and 76% had never used telehealth to access mental health care. So as expected, a very large and quick shift to how we were providing services to our veterans. And I'm very happy to report that overall, veterans were very satisfied with the care that they were getting through telehealth. They felt the technology was explained well. They felt their therapist felt comfortable and confident using the technology. Most felt that issues with the technology were quickly resolved. And about the fourth row here, 82% felt their experience with telehealth was valuable and helpful. And then these last two, 75% would use telehealth again in the future and also would recommend telehealth to a friend. And this is really important as we think about the future of telehealth care. And we know that we'll continue to provide care this way, and hopefully it'll be used to reach even more veterans. So the fact that we saw such great satisfaction with this kind of care when we did a very rapid shift, I think is very excellent news and really a testament to all of those of you who are working with veterans in this way. We also looked at access to care. How was COVID-19 impacting veterans' ability to use services that they regularly use? So we only asked, if you use the service, has COVID-19 made you unable to receive it? And at the top here, these top three, the most endorsed, issues accessing routine checkups, dental care, and physical health care. So pretty high percentages finding barriers to getting that type of care. But it's also important to note some of the other forms of care that veterans weren't having access to. For example, one of the biggest issues veterans face, musculoskeletal issues, chronic pain. And there's a lot of different types of care that are outside traditional care that they may utilize for those type of issues. You can see here, massage therapy, 30% of the sample had difficulty accessing that since the start of the pandemic. Physical therapy, 22%, acupuncture, 15%. So some barriers there in those other types of care. I also want to mention hearing care. Hearing issues, also a prevalent problem with our veterans, 22% who had difficulty accessing that type of care. So it's really important to first note the barriers that we're seeing in getting care, but also the different types of care that kind of fall out those traditional types of care we talk about besides physical and mental health care that our veterans really use. We also looked at COVID-19 experiences, attitude, and behaviors. How are you feeling during COVID-19 about COVID-19, and how are you behaving? Before we look at that, we wanted to make sure we gave a little bit of background into where people in the sample were, because obviously where you live and what kind of restrictions there are where you live are going to have an impact on maybe how you feel and how you're experiencing COVID-19. So over half the sample, 51% was living in a large city, and then another 27% lived in a suburb. And then the rest of the sample lived in small cities, rural or town or village. And most of the sample had similar restrictions in at the time that this data was collected. No large gatherings, masks were required, and social distancing was required. See a little bit more differences on no small gatherings. About 70% of the sample was in a place where you couldn't gather in small groups. And then only about half and half of the sample were the majority of businesses closing. So all of these sort of have impacts on how you view the rest of the data that follows in this section. 2% of the sample had received a diagnosis of COVID-19, and 9% had had symptoms of COVID-19 in the last 2 months. So again, keep in mind, this data is from summer 2020. One of the most important things when we think about this is we asked veterans, are you an individual who might have heightened risk for serious illness from COVID-19 due to an underlying medical condition? And 43% of our participants said yes. And I want to really highlight that, because one of the things we've been talking about as a country during this time is really recognizing those who are vulnerable to the impacts of COVID-19. And I haven't seen veterans recognized or be a part of that conversation. So it's really important as advocates that we recognize that and make sure that we're looking for those who may be susceptible to the impacts of COVID-19. As you see here, we had 43% of our sample self-identify as someone who would have heightened risk. We also asked what kind of precautions veterans in the sample were taking related to COVID-19. You can see here these top 5 precautions, the majority of the sample, over 90%, were taking part in. Washing hands, wearing a face mask, keeping 6 feet apart, and avoiding crowded places. And then what falls off, still a majority of the sample, a little bit less though, avoiding contact with people who could be high risk, 73%, avoiding public places, 63%, and canceling or postpone personal or social activities, 62%. So you're seeing a high compliance with the COVID-19 precautions in the majority of the sample. We looked at what kind of stressful events veterans were experiencing related to COVID-19 and how prevalent they were. Have you experienced any of the below stressful events? Most endorsed increased responsibilities at home at 44%. Difficulty getting food, medication, and other necessities, 38% of the sample endorsed that. 32% said they had difficulty getting needed social support. I want to highlight that one because in a lot of our work in veterans, we noticed that there's a culture of being able to take care of yourself, wanting to only take care of yourself and handle your issues on your own. And so the fact that we have 32% of the sample who are really identifying and endorsing that they aren't getting the social support they need is pretty significant. Lost job or lost income, 18% of the sample were affected financially by the pandemic at this time. 17% had a family member who became ill from COVID-19. 11% became ill themselves, and 6% had lost a family member from possible or certain exposure to COVID-19. We looked at race and ethnicity and differences between stressful events related to COVID-19 within the veterans in the sample. And similar to what we're seeing nationally, Black veterans and Latino veterans were more likely to report having lost a family member to COVID-19 than white veterans. Latino veterans were also more likely to become ill themselves. They were more likely to report a job that requires exposure to COVID-19. And they were more likely to report having a family member become ill to COVID-19 than white veterans. So a lot of those health disparities we're seeing nationwide, we are also seeing here in our veteran population. There were no significant differences between Black and Latino veterans related to stressful events. We also saw significant differences related to gender. Women veterans were more likely to report having a job that requires exposure to COVID-19, increased responsibilities at home. They were more likely to report difficulty getting necessities and difficulty getting needed social support. We asked veterans how concerned they felt about COVID-19. What is the concern and worry they were feeling about what was happening? And you see 2 columns here in this graph. And the yes is those who endorsed the item. And then there's a second column there for those who highly endorsed it. So they felt very worried about these items or scored very high on the measure on the items. So you can see here, over half the sample thinking about COVID makes me feel threatened. I'm afraid of COVID-19. There, about half the sample endorsed those items and about a quarter highly endorsed them. Of course, the biggest endorsement item was being worried that their themselves or someone they love will get sick from COVID-19, with almost 70% of the sample endorsing that item and almost 40% highly endorsing it. And also you see here stress around COVID-19, about worrying they will catch it and avoiding people because they don't want to get sick. A little bit less endorsement in both of those items. About 20% of the samples highly endorsed that they were not concerned about COVID-19. So overall, you'd expect that the concern about COVID is matching probably what we're seeing in the general population here with veterans. Women veterans were more likely to demonstrate COVID-19 concern than veterans who were men, and Black veterans were more likely to be concerned and worried about COVID-19 than white veterans. So we saw one racial difference and one gender differences between the concern about COVID-19. I also wanted to look at how veterans' employment was being affected by the pandemic. This pie chart on the right shows the employment status of everyone in the sample. We really focused on those who were working and those who were not working and looking for work, and the reasons for each. And so of those who were employed, 8% reported being very concerned, and 19% reported being somewhat concerned about losing their job. And that's very significant because we know the added stress that worry about a job loss, loss of income, loss of financial stability can put on an individual and how that can impact their well-being. 2% of the sample of those who were unemployed indicated losing their job as a result of the pandemic. And there were no gender or race ethnicity differences in concern about losing employment. Well-being, how are our veterans doing? How are they being impacted by the COVID-19 pandemic? We looked at several outcomes in our veteran population in the sample. And here you see them in order of how many endorsed or met the diagnostic threshold for experiencing each one of these issues. We'll go through each of them. The first, loneliness. 42% of the sample met the diagnostic cutoff for what we would indicate as experiencing loneliness. And I think that's a pretty significant number. We don't have a lot of reference point for what loneliness would be in the veteran population. There's not a lot of work or study on it, but I think 42% is a pretty significant number. Also, drinking behaviors. 41% met the diagnostic criteria for problematic drinking behaviors. And that's higher than what we'd see in what I'll call non-pandemic times and in some of our other research. 14% of the sample indicated that they were drinking more than usual. So that is in line with us seeing a jump in drinking behaviors in this study. Now, depression and PTSD, 32 and 30%. That's pretty in line with previous studies in the veteran population. In our previous studies in the veteran population, you don't see much of a jump or difference there from previous research. But anxiety and insomnia, 28% and 25%, are a little bit higher than what we've seen in previous work during non-pandemic times. Insomnia was measured for those with moderate to severe anxiety. We wanted to look at how being concerned or worried about COVID was also intertwined with well-being. And we found that those who were moderately to highly concerned, have worry about COVID-19, were also almost 4 times more likely to have anxiety, 2 times more likely to also have depression or PTSD, and 3.6 times more likely to indicate loneliness. We didn't see any relationships between COVID-19 concerns and drinking behaviors. Social support. We asked specifically, since the start of the COVID-19 pandemic, what kind of social support are you feeling? What is your perception of the social support in your life? Obviously, a very important part of how you are enduring this challenging pandemic. And you'll see 3 columns here in this chart. The first is the item is true for me. Second, the item is somewhat or a little bit true for me, and then not true for me. And so these first 2 items have about the same endorsement across. If I get sick, I have friends and family who will take care of me. I have a close person I can always count on. In the mid to high 60s of people who feel that's true for them. Then you have another quarter of the sample who says it's only somewhat or a little bit true for them, and about 10% each that says it's not true for them. And then we go a little bit down an endorsement with each following question. If I'm feeling down, I have people I can talk to without hesitation. 58% said that was true for them. If I have people who I can spend time with, 56% said that was true of them. If necessary, I can borrow something I need, 49%. I have experienced a lot of understanding and support from others, only 37%. And so while we see significant portions of the sample do perceive themselves as having social support, we see a pretty significant portion who doesn't. And during a time like this where social support is so essential, I think that is something to take note of and be concerned of. We looked more in depthly at loneliness. 15% of those in the sample said feelings of loneliness were much worse than the start of the pandemic, and 34% said they were somewhat worse. And I think that's important to note because of transition, because of having to find new community and new social networks. You can imagine that veterans may be a population that do have some vulnerability to experiencing loneliness. But we're actually seeing the veterans in the sample indicate that loneliness has gotten worse since the start of the pandemic. And there were 3 variables that significantly predicted veteran loneliness. The first was meeting a diagnostic criteria for depression, having low levels of social support, and gender. Women were more likely to indicate feeling lonely than men. We looked more closely at the relationship between social support and loneliness. And what we found is that COVID-19 concern partially mediated the relationship between social support and loneliness. Now, what does that mean? We know that there is a relationship between how much social support you have and how lonely you may feel. So if you have high levels of social support, it is less likely you experience loneliness. That's a strong connection between those 2 variables. But when we add in COVID-19 concern, how worried you are about COVID, suddenly the relationship between social support and loneliness is lessened, the strength lessens. And that makes sense. If you have a social support system, but you are concerned about COVID-19, then you may not be accessing your social support system. And therefore, if you can't access them, then the protections that you're getting from your social support may not be there. They may not be impacting well-being as much as you were. So this is important to know when we are looking and asking our veterans how they're doing, whether you have social support. It's not just do you have it, it's are you using it? Are you able to access it? That's going to be really important to well-being during this time. We looked at one item on the depression scale that specifically asks about suicide ideation. Over the last 2 weeks, indicate how often you've had thoughts that you would be better off dead or hurting yourself. 13% of the sample endorsed this item. It's a little bit higher than we have seen in some of our previous studies that were taken outside pandemic times. It's important to note that only a small percentage of people who experience suicide ideation will go on to die by suicide, but we know this is a very, very serious problem in our veteran population, that they are at increased risk. And so this is something we do want to continue to look very closely at. And so we looked at what endorsements of this item was connected to. Veterans who endorsed the item were 2 times more likely to have worry about COVID. They were 6 times more likely to indicate loneliness and 6 times more likely to have anxiety, and 9 and 9.5 times more likely to have depression and PTSD. As we know, suicide is very complex. There are many variables that go into it, and we see how some of those variables may be contributing to ideation through this data here. Looked at how COVID-19 concern is contributing to general anxiety. So did a regression analysis controlling for some demographic variables, depression, PTSD, and we found that COVID-19 concern predicted general anxiety. And that really tells us 2 important things. 1, COVID-19 anxiety is a significant contributor to general anxiety. And 2, that COVID anxiety may be unique. And while measuring and assessing anxiety through traditional anxiety measures, pandemic-specific anxiety may not be captured. So if you are using a screen for anxiety, such as we have here, we have the GAD-7 here, which is a common screen for anxiety. you may not be capturing anxiety that is specific to what is going on related to the pandemic. So anxiety may be higher than what you're capturing from this measure. So I think that's a very important finding. Finally, we did pull together some of the results from the most recent data collection. How is well-being changing over time as things become more difficult as we endure this pandemic longer? And you'll see a little bit of difference in the numbers here because we only include individuals who completed data at both time point 1 and time point 2, and that was about 150 veterans. But what we're interested in looking at is statistically significant changes over time. And all of those in time 2 that are asterisked are where we saw those significant changes. First is loneliness, a very high jump in loneliness from time 1 to time 2 that was statistically significant. Depression and PTSD, we both saw small increases, but they weren't significant increases. Small increase in anxiety that was statistically significant, and a pretty big jump in suicide ideation from 11% to 20%, which is concerning. And lastly, a significant decline in perceptions of social support. So 2 kind of comments from this data. One, we are seeing some declines in well-being over time through this data in the veteran population. And I also want to highlight that suicide ideation number, a pretty big increase there from time 1 to time 2. And a lot of the work that we've been doing related to suicide prevention, the MVP, a lot of the work that Dr. Castro leads is about trying to think more holistically about suicide prevention and think about the complex nature of suicide and not just mental health. And we've really been pushing relationships, social connections, and how important that is to well-being. And if you see here, the one place where we see a similar jump from time 1 to time 2 as in suicide ideation is in loneliness. And we don't see those jumps in depression or PTSD, but we see the similar rise in loneliness. And so really want to highlight the importance of how we think about suicide and making sure social connection and encouraging healthy relationships is a part of that conversation. Real quick conclusions from what we just gone over, which I know was a lot. We saw a positive transition for veterans to telehealth care. Telehealth care will continue to be an important and viable option for reaching and expanding our reach to veterans. Although it's still important to think about those services that can't be provided through telehealth care and the limitations that some people have, specifically internet access. I believe the most recent VA data shows the mid 30% of rural veterans still do not have broadband internet access. So that will be a barrier for a lot of people as we continue to expand telehealth care. Veterans continue to have barriers to receiving the services they need. And we need to continue to think holistically about all the services that veterans use and how we can provide access to them beyond just physical and mental health care, which are both very important. We saw that veterans have been significantly impacted by COVID-19 related events. And we also saw those similar racial and gender differences that we're seeing in the national data. We saw that most veterans were concerned and that concern about COVID-19 was impacting well-being. And highlighting again, the importance to recognize veterans as a population vulnerable to the impacts of COVID-19 and identify those areas of increased susceptibility for negative outcomes and how we can intervene and how we can make positive changes and build in whatever protections we can during these difficult times. Again, important, especially during this time, is encouraging opportunities for social connection and fostering strong relationships now and after the pandemic ends. We need to be thinking ahead. Once we are able to slowly go back to a different but more normal type of living and being around each other, how can we encourage those social connections and those re-engaging of those connections for our veterans? I think that's going to be very important. And lastly, of course, we did unfortunately see a significant decline in some measures of well-being over time in the veteran sample. So I'm going to go ahead and we will start the Q&A section. I'll invite Kelsey and Dr. Castro to go ahead and join me. Real quick before I do that, just a reminder that you can keep in touch with these findings and follow up on the work that we'll be doing with them by following us. And there'll be information on how you can do that in the follow-up emails. Following us on social media and being a part of our email list is how you can continue to know and follow up on the work we're doing here. So Kelsey, I'll go ahead and hand it over to you.
Thank you, Dr. Kinsel, for the excellent presentation. We've had some really great questions come through, so we're going to go ahead and get started, and feel free to keep sending them as well. So the first question is, you've named a bunch of challenges facing veterans right now. What, in your opinion, is the biggest challenge facing veterans during the pandemic?
I think it's the biggest challenge that's facing all of us, and I think it's the isolation and the interruption to relationships. And I think that that just has such a huge impact on well-being. And I think that there's a lot of veterans who are already maybe vulnerable to having limited relationships, or just really rely on the people who've had similar experiences to them that they can connect with and talk about their experiences, and just not being able to do that. So Dr. Castro, I don't know if you want to join in and agree, disagree.
Oh, no, I think that, that's an important, very important point. And although one of the strengths that veterans have sometimes is we like to be left alone and we like to kind of self-isolate, I think you see some of the harm that can have for some of our veterans. So even though it may be one of our preferred modes of coping, it's not always the most healthy form of coping. So we always should keep that in mind. And I just want to comment, I was just so happy to see all the veterans taking all the right 90% range. So I was just thrilled to see that. So I just want to kind of give us all a kind of pat on the back for, doing the infectious disease prevention efforts. So anyway, kudos to all the veterans out there who've been doing those things.
The second question is, what is defined as a small gathering during this study?
I think it was less than 10 people. Those measures were specifically from, I believe, public health, right, Dr. Castro? That's where we got those that have been recommended to use when you're measuring, looking at COVID attitudes and behavior. So I think it was less than 10.
Great. The next question is, how has the psychological well-being of service members that are also students been affected? As a professor and an expert in the field, maybe you can touch on this a little bit.
I'm happy to touch on it. We don't have data specific to student veterans in this sample, but I can anecdotally as a professor, and I'll let Dr. Castro jump in as well. I think, it's been difficult. It's been difficult for all students, but I have found myself needing to connect more students to resources. A lot of financial hardship for sure. I've found myself having to advocate for more of our veteran students, getting caught up in some of the bureaucracies of how they handle their benefits and how they get the things that they need during their schooling. So I think they have definitely been affected, probably to the same extent that we're seeing here in this data, with the added stress of how everyone at a university, how students have been affected.
Yeah, and just to really comment on one of the points you made, with the pandemic, a lot of offices, support offices have shut down or have, they're not as responsive, and that affects all of us. And it also certainly affects student veterans and veterans in general who when they have a administrative issue, they can get tangled up in bureaucracy because folks just aren't available as much during a pandemic as they would be during a non-pandemic. So that adds to the stress and it adds to the timeline to resolve difficulties.
The next question asks for advice for social workers if they are working with veterans who do not want to engage, especially during a time when they cannot go out as much and have face-to-face contact.
Wow, Dr. Castro, I'll let you take that one.
Well, one of the things about engaging and building relationships, you can't force someone to have a relationship with someone else. And so, like if I want to talk to Dr. Kinsel on the phone, I'll phone her up and maybe she doesn't want to talk to me and that's okay. But then I can call her a couple of days later and then a couple of days later. But just kind of keep checking in because eventually I'll catch her at a moment where she wants to talk and open up a little bit. So what I would say is you have to persevere in relationships to take care of each other. We can't just, well, I called you once and you told me to bug off, so I didn't call you again. We got to continue to call and continue to provide support because eventually we'll get to a place where we want support. So don't give up. Don't give up. That would be sort of my my kind of plea, and just, you know, give them some space, but then follow up.
That's great advice. So the next question is, has the data from this study been compared to similar data of when military members are on deployment?
We have not compared to deployment data in here. I'm not sure if there is other than the mental health measures, a lot of the measures would be different. I don't know of a lot of deployment data that looks at social support or loneliness or those type of things. But no, we have not compared this data to deployment data. I don't know, Dr. Castro, if you want to jump in and see how you might expect it to look similar or different.
Well, I mean, you could do some like gross comparisons, and that's, by the way, a wonderful thing to look at and something that we could certainly do. But I wouldn't make a lot out of those kinds of comparisons unless it's part of the same study. There is a larger study within DoD where they are surveying service members. I think it's primarily Army, but I think they also have some Navy folks in there too. And they will be in different places around the world, and some of them may be on deployment. I'm not sure, but I'll reach out to the lead PI on that study and see if they have data that is specifically on deployment, and if we can share it. And if we can share it, as Dr. Kinsel said, we'll post it on our website and get that information out. But that's a great question.
Can you speak to what some of the questions you used during the study that measured loneliness?
Yeah, so it's a validated measure of loneliness. If you want to go up to the next question, I will actually pull up the items. I don't have them on me, but if you want to go to the next one and come back to me, I can share what those items are and I'll pull them up.
Sorry, I muted myself. Kind of similarly, how can people and agencies address loneliness during the COVID-19 pandemic when social distancing is a factor?
Dr. Castro, can you take that while I pull up?
Sure, I'll take this while Dr. Kinsel's looking for the items. So, you know, a part about having meaningful relationships, there's a touching component to it, right? You know, like shaking hands when you meet someone, putting your arm around a colleague to comfort them, hugging someone, a close family member or a close friend when you see them. And we're not supposed to be doing that. And that's not normal human behavior to refrain from those things. So we have to come up with other ways, you know, things that we can do collectively that we enjoy and have fun. I'll tell you, like over the holidays, my wife is English and all of her family live in Europe. So we did a New Year's Eve and a Christmas Eve quiz over Zoom for the holidays. And so that's one way you can stay connected and have a lot of fun, you know, because you want to do fun activities as well. And playing games and doing like a pub quiz is very traditional in England, and it's actually a lot of fun. And so there's ways that you can stay connected and share experiences over holidays and have fun. So we just need to think more creatively around things like, what do we enjoy doing? Obviously, you can't go fishing together. I guess you could, but you'd have to be, you know, like 10 feet, 6 feet apart from each other. But we just have to be creative and not always have things be about making physical contact, because that's absolutely what you don't want to do during a pandemic, because that is how germs and viruses spread.
So Kelsey, I have those items. This is a short scale for measuring loneliness in large surveys, and it's by Hughes from 2004. And I'm happy to share this reference if anyone's interested in looking at the items. But the questions are, how often do you feel that you lack companionship? how often do you feel left out, and how often do you feel isolated from others? And they're measured from hardly ever some of the time to often. And then they had validated a range that indicates through their research a cutoff score that indicates loneliness.
Thank you, Dr. Kinsel. The next question is there any data on housing impact due to COVID for veterans?
I think I know there's people doing a lot of housing work. I haven't seen any data come out yet, specifically with results. Dr. Castro, I don't know if you're familiar with any of Dr. Henwood's results or anything like that, or Dr. Davis yet, if they have any results yet.
I haven't. Obviously, you know, anytime there's a crisis or disaster like a pandemic, flood, hurricane, drought, it's the most vulnerable populations that are impacted the most, right? And I wouldn't be surprised at all to see that being the case here as well.
The next question is regarding the well-being measures. Do you have numbers reflecting the general population for comparison? Wondering if veterans have been affected to a greater degree.
I don't have those yet for comparison. I haven't. Studies about COVID-19 are really just, you know, the process of getting things published can be slow, and those studies are just coming out. And so I wouldn't use this data right here to compare to the general population. We really use the data to look at factors that impact these well-being measures. What are the things that are going on? How factors and different outcomes relate to one another. And that's really how we're using the data at this point, just because we don't have that comparison. And you'd have to be pretty careful on how data was collected and who it was collected with to make such a comparison, unless you were doing a specific comparison study. But you know, veterans are a vulnerable population, and we know that vulnerable populations have been more susceptible to the outcomes and more susceptible to negative outcomes during COVID. So it wouldn't be a far reach to say that it's possible that they are experiencing more difficulties during this time.
The next question is asking if you're able to post the Hughes scale question so that they can download and capture it. And the questions and scales you use for the well-being measures, will that be provided to the attendees today?
I can send out the references for all the skills to everyone. Yeah, and I'll get that to Kelsey and Jennifer, and it can be part of the follow-up email. I'm happy to share the references to those.
Great.
And if you can't find the references, you can reach out to me. I can help you get them.
And then the final question for today is how can the VA provide COVID-19 vaccinations to veterans who are in the Tier 1B, so age 65 plus? The VA has income restrictions preventing vaccinations, creating additional frustration. How would you suggest getting around this impediment?
I am not sure that I am not a public health vaccine distribution expert. So Carl, I don't know, Dr. Castro, I don't know if you have any thoughts on that, but
the impediment that you mentioned, Kelsey, what was the impediment? The distance to places? I wasn't clear what the impediment was.
It is the VA has income restrictions preventing vaccinations for the Tier 1B age 65 plus population.
Well, I didn't think there were income restrictions for the COVID vaccine. So that's news to me. I didn't realize that because I thought that the vaccine was given to everybody regardless of income. So I've not heard that. But, I'm also one of those people who thinks, see an arm, put a needle in it. I don't even like those categories. I just think anyone who wants it, now that they've done the frontline people, line up and lets everybody get vaccinated. That's sort of and I'm sure in the next few days, if not by tomorrow, that the new administration, that's exactly what they're going to do. In fact, they've already signaled that they're going to just jab people, right? That's an English term. We call them shots. They call them jabs. Just start jabbing arms. See an arm, put a needle in it, and then move out. And I always think back to basic training, how we got our shots. I always called it a gauntlet because that's when you could do those air guns and they would line you up, with 6 or 7 folks on each side, and you took one step forward, step forward, step forward, and then at the end you got the oral polio vaccine. So we need a system like that that's efficient and gets everybody through it. But of course, we want to make sure the most vulnerable receive the shots first. And I think we're kind of through that, but I didn't hear about the income thing. I'll do some research on that. I had not heard that.
I'll just add too, I think, for those of us who are working with veterans, advocate, tell them to get the shot wherever they can. If, there's going to be lots of different places where hopefully where these are available, go through your local community. If the VA is not, make sure that we're looking beyond just the VA to vaccinate veterans, even though they will push that out. Wherever you can get a vaccine, let's be advocating for our veterans to go get one wherever they can.
And take a friend. You go together and get a vaccine, although maintain social distance if you're not supposed to be around that person, but take a family member that you're living with. So.
Great. Well, thank you so much, Sarah and Carl. That's a great place to stop the Q&A. And thank you everyone for your great questions.
Thank you. And great, wonderful job, Dr. Kinsel. What a great presentation.
Thank you all so much.
Thank you so much for just joining us and sharing this amazing data and all the questions and the research that was involved. Before we end, I wanted to once again ask Dr. Carl Castro and Dr. Sara Kintzle. USC here at the School of Social Work, we do have this wonderful military and veterans programs. I wanted to ask if you can share a little bit of what you all are working on. If there is a potential student who would like to come and study military social work, what can they do? How can they find out more information?
Sure. Well, we always have a lot of different things going on. And of course, during the pandemic, we've had to shift some things, but we have a lot of work going on topics such as obviously everything you're seeing here, continuing this work on COVID and looking at how our veterans are doing during this time. We are doing work on diversity and inclusion in the military, also very timely and important research, work on social networks in the Army and the Navy and how that impacts certain outcomes. There's a lot of really innovative things. Dr. Castro is working on veteran radicalization project with Dr. Otwell. A lot of really innovative, a lot of really great research being conducted. And of course, we have our community projects, the LAVC, and hopefully we can re-implement a lot of the things that were going on prior to the pandemic, the LAVO, which works to socially connect veterans. So there's lots of ways to get involved. And the best way to learn about them is to be on our email list, follow us on social media. You'll see what's going on and you can reach out to anyone on our team to find out how you can be involved.
Great. Dr. Castro, any parting words?
I just want to thank everyone for their interest in in veteran health and well-being, and specifically in how the COVID pandemic is impacting veterans. One of the things I'll just also say, we also have a lot of family research going on in the center too, because we recognize that veterans have family members and we're going to, and providers and support people who support veterans. So Dr. Kinsel has actually been leading that effort for us as well. She didn't mention it, but I just want to give her a plug. So we're taking a holistic approach. We know that the solution to a lot of the challenges that veterans and their families face will take time to solve, but we're committed, to the long haul. Some of these we can solve quicker, but if anyone's interested, please, as Dr. Kinsel said, sign up for our newsletter, drop us an email, and we'll see if there's a way that we can continue to work collaborative together.
Great, thank you so much. I'm going to go ahead and share one more slides here, just to for those who again would like to reach out to Dr. Castro and Dr. Sara Kintzle. Their emails are listed here. Again, amazing resources here at the USC Suzanne Dworak-Peck School of Social Work. highly regarded leaders in military and veterans programs and research, as well as community engagement. I know there are a lot of questions about how do we connect our veteran community to the relationships and social support that Dr. Kinsel mentioned. And if you have any questions on that, please reach out to them and they will direct you to the right place. We also ask that you support our military and veterans programs here. And if you'd like to make support or support military scholarships, please contact myself, Jennifer Chanvanzini, and Kelsey Viano. We're here to connect with all of you. And for future events, we already are planning the next webinar with Dr. Carl Castro and Sara Kintzle as we continue this conversation on how to support our veteran community and learn from the research and how do we implement this even after the pandemic, because we know that a lot of the things that Dr. Kinsel mentioned today, the loneliness, the suicide ideation, PTSD, that will continue on even after, as Dr. Carl Castro mentioned, we all get jabbed in the arm with the vaccine. There are still a lot of issues here, and we ask that you join us in supporting our efforts. Thank you once again for joining us today. We appreciate you taking your time to listen in, to support, and to applaud the work that our doctors here are doing here at USC. Thank you so much and see you next time. Fight on.